Today, I want to talk to you all about antimicrobial resistance. So, to define antimicrobial resistance, or AMR, it is when viruses, fungi, bacteria, and parasites evolve to no longer respond to traditional antimicrobial drugs. So, I want to talk specifically about bacterial AMR. So, we heard from John, bacteria are super cool, great at creating plastic, but they're also super bad in the wrong places in the human body. So, to start off, bacteria are everywhere. They help us create the foods that we love to eat. So, cheese, kimchi, yogurt, certain types of beer are created with bacteria. They're also really useful in our human body. The bacteria that can compose the gut microbiome help us digest foods. But when they colonize the wrong areas in our body, they can cause infections that can be deadly. So many of us probably have experienced sore throats. Certain sore throats are caused from bacterial infections. Similarly, urinary tract infections are caused by bacteria. So, okay, let's just make more antibiotics. Problem. It takes 10 to 15 years and about 1 billion pounds to bring a new drug to market. However, antibiotic resistance is usually reported within 2 to 3 years. So there's literally zero financial incentive for pharma companies to create new drugs. And because of that, the last new class of antibiotics was developed in the 1980s. So it's been over 30 years since we've had a new class of antibiotic. That's very scary. So how does bacterial AMR happen? So in general, some bacteria in our body will inevitably gain some resistance to antibiotics. This is inevitable. The evolution timescales of bacteria are so much faster than the evolution timescale of humans, so they're rapidly developing new resistance genes, and this will happen. However, when we add antibiotics into this mix, we remove all of the non-resistant bacteria, and the resistant bacteria survive, which means that the resistant bacteria are able to multiply and therefore comprise a larger percentage of the bacteria that we're exposed to. So ultimately, there is an urgent need for innovative strategies to combat bacterial infections. And there's tons of work being done to look at kind of solving this crisis from the molecular level or from kind of the microbial level. But what I want to posit is, what if we just physically remove them? So my background is in therapeutic ultrasound. And during my PhD, I looked at using focused ultrasound in combination with particles that are responsive to ultrasound in order to deliver drugs to cancer cells or kill cancer cells. So we figured, why not just use the same technology in order to eliminate infections? So bacteria meet the microbubble. This is a microbubble that's being exposed to really high intensity ultrasound, and it's causing it to kind of go crazy. And these violent oscillations of this microbubble, we theorize could be really useful in destroying bacterial infections. So to back up, microbubbles are used for ultrasound contrast, and they're used clinically as ultrasound contrast agents. And they're literally just bubbles. So they're gas core stabilized by a shell that's made of a material that's able to keep that gas bubble intact. And they're used clinically to provide contrast within the microvascular perfusion. And so as we can see here, all of the bright areas are bubbles, and this in this example is used to delineate where a tumor is in the liver. So that kind of area that lit up really bright at the beginning, that's a tumor, and it's more easily diagnosed with microbubbles because they can show us something about the function of an organ based on its blood flow. And the reason that this works is that ultrasound causes microbubbles to vibrate. So ultrasound is really just sound. It's just at a frequency that's way higher than what humans can hear. We can think about frequency of sound as pitch. So if I speak really low versus speak really high, then my pressure got a little bit messed up. Then that's changing the frequency of sound. So lower frequency would be lower pitch, higher frequency, higher pitch. Ultrasound, way beyond that. We can't hear it. However, ultrasound is still just sound. So it's just a pressure wave over time. And when we put a microbubble into that environment, the microbubble expands when the pressure is increased, and then it compresses when the pressure is increased, expands when the pressure is decreased. And that oscillation of expansion and contraction can cause a microbubble under normal diagnostic imaging modes to do this kind of predictable vibration. And those vibrations create specific frequency signatures that we can use to isolate and create those images that I showed on the previous slide, where it's like a bubble-only image. But if we ramp up our pressure intensity, so the height of that sine wave, to be 10 or 20 times that amount, and the bubble can do really interesting things. So for example, that crazy vibration of the bubble, that's with the same type of sound, but just with a really high pressure. And if we put a lot of bubbles together, so in this example, we've got a volume of bubbles and they're all kind of that white speckly texture. If we hit it with ultrasound, then it can cause destruction of the bubble, movement of the bubble, and all of these kind of interesting mechanical forces that we think might be able to target bacteria and eliminate them. And in fact, that is exactly what I do. I did a great job with that. So in this example, the bacteria that I use are dyed in green. And so I culture bacteria in these cell culture insets that I then expose to ultrasound. As we can see here, I non-invasively with ultrasound and microbubbles was able to clear part of the infection within this kind of in vitro system. And this is super exciting. We can cause removal of bacteria, but there's tons of really interesting questions that can come from this that I've been spending the last year and some change and going to spend more time researching. So for example, how much ultrasound pressure is required to do this type of activity? What happens to bacteria after we hit them with ultrasound? Are we killing them, or are we just moving them such that they could go on and reinfect other areas? Which actually wouldn't even necessarily be a bad outcome. Sometimes bacteria that exist in solution are easier for our body's immune system to clear than they are when they're in kind of like a film like that. So tons of really interesting research questions that can be asked with this. So I want to conclude with what I view as the future of ultrasound and microbubbles for treating infections. So some of the kind of diseases and applications that we're looking at in the lab include urinary tract infections, as I mentioned earlier, where bacteria are able to colonize the bladder wall or the urinary tract wall. And a lot of these infections have bacteria that are antibiotic resistant and can be really painful and really difficult to clear. And so we think that using ultrasound and microbubbles may be a really simple way to physically clear infections that can be easily then secreted by the human body. Likewise, some members of the lab are looking at treating chronic wounds with ultrasound and microbubbles. So in patients specifically with diabetes, they have a really difficult time fighting chronic wound infections, and therefore they develop these infections that can be just really challenging to treat. And so possibly with the addition of ultrasound and microbubbles, we think that maybe that might be a novel solution that could be implemented in the relatively short term. And then finally, I think, and most excitingly, one of the big applications of this technology would be to clear infections that are on infected medical devices. And this would allow us to be able to treat these infections without having to undergo the risks of removing and replacing a medical device. So I hope that I've convinced you all that ultrasound and microbubbles may be the next new class of antibiotic. Thank you.